そういう場合には
In this case.
リネンある日はこれだけ使います。
Some days you use that much.
で次の日はギュッと使っ
On the
て
next day you may finish the rest.
ここまでちょっと管理は難しくな
You
りま
want
す。
to increase the number of bins and decrease the amount in each bin.
Monday was great. It was like drinking out of a fire hose. For many, it was their first exposure. For some of us, we've had the opportunity to reinforce some of the learning and take it in a much deeper way into understanding how the system works.
気軽化を説明いたし
So
ます。
now we'd like to show you how the Kanban circulate within the actual line.
前工程になりたい量はこちらがその前の30分ごとにぐるぐるっとこう回っていって
They're on a schedule, they come around,
看板は
and then you cut the parts.
The methodology is very clear. Today is the day when you really start to get down there.
We were looking forward to getting to the doing part, and here we are in the doing part, so we're very excited about that. Like, should we clean the cart off? We've decided on what type of Kanban we're doing, and now we're collecting some boxes, and we're going back up to level 4 to start labeling and getting our boxes ready, or our bins ready for our products.
And then when you run out, restocked by the emergency room porter.
ポーターがこう
Storeroom, yeah.
ここに入れちゃう
Material. And the,
It's
completely empty and you already find it. In Japan, we just
We'd like to introduce you to our IV dispenser, the first in North America that we're aware of.
It probably works.
So the way this operates is this top flap opens up, materials management inserts the product in here. The nurse pulls out the supply here, and the other one drops down. This piece over here is inaccessible.
Yeah, inaccessible in the plugged in. Basically, you open the second half of it, you pull out the Kanban.
And you put it in the Kanban post, and the whole process starts all over again.
They've been working very hard all week. I can see very busy cleaning, sorting, labeling, and putting the system in place. It looks really excellent. I've been a nurse at the hospital for 25 years, involved in the process of gathering supplies, and which seemed to work very well, quite easy to understand, works quite quickly, and very visible to see what you're getting and what supplies you need, and also very good for the rotation of supplies so that there isn't stock that's sitting for a long period of time. So it actually seemed to be a very, very easy system to use and worked very well.
Yeah, we had lots of learnings from this week that we hope to share across the province, and really the process was great. Involving staff on the wards was also really helpful. We're going to be standardizing some of the products like bins so that we are able to get not only savings in buying those bins but standard work across all of the different sites. So 3S Health will be coordinating the implementation of improvements related to Kanban and inventory flows across the province, working with the health regions.
That's great advice. We were about to make a mistake. Everything will be dealt with through one process in parts 4 and 5. One process.
We've been able to reduce sitting supply by over 60%. So, I mean, for a couple of weeks worth of work, it's pretty significant, as well as the cost savings. And I think that's something that we always have to consider. We talk in percentages, but when you're considering, you know, it's thousands of dollars of extra inventory that's just sitting on a shelf, certainly can reduce the hospital's expenditures. If we make sure that we get our numbers right and we can be as lean as possible, I think that's really going to make a difference to the bottom line for the hospital.
There's lots of work out there to do. That doesn't stop. But again, it's really important that we be able to present to our Minister of Health and ultimately the people of Saskatchewan that we're removing waste and we're giving them an excellent service.
This has been a great precursor to the RPIW. We're getting to use the forums and we're getting more comfortable with them, and we're getting to understand really how much work it is and what kind of data collection we need to do. often in healthcare we're not that strong in using data for decision making, and this gives us practice doing that and shows us how important the data is.
We were able to reduce the amount of stock on hand at in the dialysis department. Even though they had done 5S and reduced their stock a great deal, we were able to bring it down by about over 50% in that department. And so we're quite excited, and we see this this being a great process for all of our whole hospital to take.
So, and great leadership here at Prince Albert. Really great leadership, teaming, and that's what we see in the entire province as we do these events.
It's really been an opportunity to use the skills that we've been learning through our lean journey, and actually had patients say to us, well, this is exciting. And because we really do have to thank our patients and their families who had to, look at some of our planned and managed confusion and change, and they were very supportive. And actually, we had one patient who wanted to participate and go get some of the materials. So I think I've just seen real life examples of how our Kanban and process and our lean journey has made and will continue to make a difference for our patients.